Did you freshen up your tea? Because you really giving us tea tonight, and I'm just saying. Mm, 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 mm. You're giving us tea tonight, Dr. Joseph. Oh, you dropped a lot on us tonight. Like, you really dropped a lot on us tonight. And I just want to know where can we go from here in the sense of the public is more aware because we didn't know. We had no idea. We had no idea of any of what you're saying here. And if I can be very frank, um, Dr. James King is the head of Clearview. He's the head of Clearview. Who is the head of the hospital? Who is the sorry? Who's the head boss or at the hospital?
Well, the medical director is Dr. Duncan, Albert
Oh,
Duncan.
okay, okay. Um, where do we go from here? Dr. Joseph, what do you think? I mean, we have this discussion. How do you feel? What do you think needs to happen now? Where do we go?
Um, where do we go from here is multifold. So I will continue to do my part in terms of education. It's going to take more than 2 years for people to fully become aware. Yes, people are opening their eyes. Yes, people are listening, but there's still some, well, I don't want people to know. I see it every week. So a mother will call, let's say, for appointment for her son, but she'll tell the son, oh, follow me up the road. I need to collect something. They come to my office, and that's when he finds out it's a mental health appointment about him. And so it can get very angry, very aggressive. Sometimes police have to get called. So I want it to be just like you would go to urgent care because you have a headache or your blood pressure is high. We need to get to the point where if we're depressed, if we're anxious, if we're stressed out, burnt out, overwhelmed, we go and seek help the same way. Psychiatrists, psychologists, therapists, there are options available. The other thing that needs to happen is there needs to be action, particularly at the level of the government. In most developed countries, mental health resources are available at a government level, readily accessible, cost effective. Majority of the mental health care in Antigua is through the private sector. Most people can't afford it. Everything, the prices are going up. One of the places people compromise is in their health care. Going to see a doctor is lower on the list compared to the school fees, buying food, gas in the car, etc. And so we need proper mental health facilities, whether it's clinics, hospitals, where people can feel safe, where people can recover. The purpose of mental health treatment is so you can return to society being functional. Mental health is not something to be locked away anymore. That's the way our ancestors thought.
Yeah.
People with bipolar, with schizophrenia, with depression can own their own car, own their own house, have children, get married. They can do everything. And so it's not a death sentence. It doesn't mean that your life is over. It's treatment. Mental health comes from the brain. So just like you have heart failure or kidney failure, or you have diabetes because your pancreas isn't working, depression and anxiety is coming from a chemical imbalance in the brain. It's an organ in the body. They've shown that schizophrenia, depression, all of that, they can show you the areas on MRI scans, PET scans. That's actually contributing to how you're feeling. It's not demon possession. Nobody gave you nothing to drink. It's a medical condition. So you seek help from a medical professional, a mental health professional, and you can go back to being functional just as you would with a medical condition. But we need resources to offer to people when they need it. I've done my best to raise the flag privately. I've taken my cause to several sections of the government, as I explained earlier.
Hmm.
I've sort of reserved that I'm going to have to do this myself. And so I am now looking for individuals who are also seeing the need and are willing to help in whatever capacity you can.
Let me
It's
just
gonna,
give a little 1 second, Dr. Joseph. Let me just give a little plug. Guys, could you help me to just notify those who might have left because they thought that Dr. Joseph left? I think I did poor show planning just now. I think I did poor show planning just now. So help me to get everyone to know that Dr. Joseph is still here. We are still having this conversation because we really need to talk about the healthcare system that's being offered. And like you said, healthcare, health is wealth. But individuals, like you said, always prioritize, like that's always at the bottom of the list, because
Mhm.
especially low income families,
Mhm.
excuse me, things are so hard, being a single parent, struggling, even if you're in a full parent home, or
Mhm.
both parents are in the home, it is still very difficult sometimes financially. So that is the last thing you're thinking. And like you said, with regards to, when we were much older, you're thinking, if you let anybody know that you're having, certain depressive feelings and depressive
Mhm.
thoughts, that they were just thinking, oh, you just need some prayers, you just need some
Mhm.
anointing oil on you. You just need somebody to just, you demon possessed. And excuse me, not understanding, like you said. 1 second.
Sure.
Sorry. Yeah, not understanding, like you said, that these things are triggered in many ways, and I'm not certified to even understand it. But I would want us to, we have you here tonight, and I want us to use the opportunity wisely to get an understanding. When you're talking about mental health, we're saying mental health or mental wellness. uh, Give us examples for the young ones and examples for, mothers, or early signs, however you can share it and categorize it. I don't know what's happening tonight. 1 second.
Sure. So with the young ones, so with children, one thing that it can show up as is a change in behavior. So if there's a child that's usually quiet, or they're doing their homework, doing well in school, all of a sudden the grades are dropping, school is calling, we haven't seen them in 3 weeks. You're finding books or evidence that they're getting into something. It can be a bad crowd, it can be drugs. Um, it can be what they're looking at, listening to music wise, what social media, for example, especially with our young females, there are actually social media groups that are promoting eating disorders. That's a real thing,
Are you serious?
right? Very serious. And so our young people are seeking, they're trying to learn how to become adults, but, and this is nothing against any parents, but we're busy.
Mhm.
Some parents are working 2 or 3 jobs to try to pay APOA and medical benefits and all these other places. And so the children, all they have is their devices and their friends.
Mhm.
And if their friends are being misled by somebody else or something on social media, it trickles down. And so our children are struggling with low self esteem, low self worth. They're also struggling, some people are struggling on an intellectual level, and they retaliate rather than asking for help. Or if their classmates recognize it, they start to be bullied, they'll act out. Unfortunately, a lot of our young people are self harming, cutting, burning, usually on the forearms. What I've noticed or heard a lot of, they're cutting in places you'd have to strip them to find it. So between the legs, for example. So it's not as obvious as it used to be. Um, for our adults, we are typically anxious. We have a lot of responsibilities, a lot of demands. The demands are increasing, but we have no resources as to how we're going to deal with all of this. And it's not just finances. You're at work, and all of a sudden somebody leaves or somebody's sick, and you're now having to do two and three different jobs, same salary, you're working later. This is cutting into your family time, your relaxation time, but you can't say no because then you need the job. And so it can spiral into depression, can affect your sleep where you're having difficulty falling asleep or staying asleep, can affect your appetite. Sometimes your stomach's so nervous you can't eat, or some people stress eat because it's the only thing that gives them pleasure of everything they do in a day. Some people get to the point where they start to think it would be better if I just wasn't here, or ending their life would fix all of the problems. And that's when you're heading into a very dark place because you've been stressed for too long, stressed too thin. And it doesn't make sense to someone who's mentally well, but when you're in that place, it makes sense.
Mhm.
Sometimes we're mentally broken to the point where reality is getting distorted. You're at home by yourself, you know you're at home by yourself, but you're hearing a voice talking. Can be a whisper, can be something telling you to do something. Sometimes you think you see somebody out of the corner of your eye. You know you're at home by yourself. Sometimes it's paranoia. I've had people in my office that are convinced somebody's watching them, somebody's going to kill them, that somebody's stealing their money. It can vary. None of this is based in reality, but your reality is distorted and you believe this even though there's no proof to it. Some people get anxiety to the point where they get panic attacks, chest pain, chest pressure. You can't catch your breath, you're sweaty, tunnel vision, you feel like you're about to die. And some people can have 3 or 4 of these a day. Some people have them every day. Or elderly, some struggle with depression, but a lot of what I see in the elderly is loss of memory, dementia. When dementia gets really bad or towards the end, they can also hallucinate. So again, seeing or hearing things, or you believe that somebody's in the house trying to kill you, that sort of thing. So there's a lot that can manifest, but just because a lot of times we think because we get into our car and drive to work, we're okay. We're not like the guy on the corner, clothes filthy, talking to himself, drinking out of the gutter. If you have anxiety, you have mental illness. For a lot of us, if you're so stressed you can't sleep, you have mental illness. And so there's different varieties, if you will. It manifests in different ways. It doesn't mean that one is better than the other or one is easier than the other, but they all can be helped. So what I tell people all the time, because for a lot of us, we only go to the doctor when it's black bleeding or falling off. We don't go for a regular checkup. So we assume that we're healthy. So if you're going through something, start with a medical doctor. It may be something is off. Your electrolytes are low, your thyroid, which is a gland in your neck. This can affect mood, memory, energy, sleep. So just a physical exam and some basic blood tests. If all of that is normal, then it may be you need to see a mental health professional. So a psychiatrist like myself, or a psychologist, or a therapist, just to get an idea of how to manage stress, how to manage anger. Actually, the first thing you should do if you're having trouble sleeping is sleep therapy, figuring out behaviors that's working against you. Medication should be a last ditch effort. So not because I'm a doctor means I'm just going to be throwing prescriptions. For a lot of my patients, I recommend starting therapy first. If you're struggling in therapy, or therapy flared up some memory, for example, that's making your anxiety worse, then a medication could help you through the process. But not everyone needs a medication. And what I usually tell my patients, I don't want to see you 2 years later and I'm writing the same medication. Of all the different facets of healthcare, mental health is one part of healthcare that you can treat just with counseling and get off medication. A lot of people on diabetes and high blood pressure and high cholesterol, they just take the pills. Yes, I should exercise and diet, but they don't really do it. In mental health, if you do the work in counseling, you can get whatever it is under control for most conditions and not need medication. So what I tell people is if you do need medication, it should be short term. I'm not a pill pusher. I don't like people on medication. So if you do need it, it should be short term, but you also have to do the work, which would be the counseling piece of it.
You have a big job on your hands. A very big job on your hands. You're saying that this job is so big. We have the situation at Clearview. We have the
Mm-hmm.
situation at Mount St. John Medical Center,
Mm-hmm.
Sir Lester Bird Medical Center. I mean, all right. So you identify the various age groups having, their own experiences.
Mm-hmm.
How do you approach it? How do you approach? Have you had scenarios where young people are seeing stuff too, or hallucinating?
I have. The cases I've had of young people hallucinating have been drug related,
Hmm.
almost always drug related. There are a few cases where it's schizophrenia, which can start as young as 15, where you start hearing things, seeing things, your behavior is just disorganized. You're eating the soap, you're doing weird stuff. But most times in our young people, if they're seeing things, hearing things, believing things that don't exist, I would recommend getting a urine drug screen. You can go to any lab and order it, and they should be able to pick up on something. Most of the times, it's positive for marijuana. Sometimes it's marijuana and cocaine,
Mm.
but the common thing is usually marijuana.
Okay. This question here, does Dr. Joseph still work for the government?
No, I do not work for the government. I worked at Sir Lester Bird Medical Center for a year. I left in November of 2022, and I spoke earlier about the reasons why I left, but just to recap for you, Tovina, um, I was hired there to do mental health at the hospital. My plan was to set up a clinic for the public, even though it would be at the cost of my private office. I asked for medications to be in the pharmacy for me to use in cases of emergency. I asked for rooms where I can admit people, treat them, send them home without having to do tests, get to clear view, just sort of make it more efficient. All of my requests, I was told no. And so I left the hospital when I wasn't being called to see people at the hospital. They were just sent to my private office. And because I charge at my private office, people were cussing and swearing at me and my mother and several generations that I was trying to rob poor people, as if I was trying to divert people to my private office. And so I wasn't given the resources to do the job properly and safely. And once my reputation was getting tarnished that way, I decided to leave. So I've been focusing through my private office, which is in Upper Gambles.
Okay. There's another question here. What are your thoughts on a private psychiatric hospital in Antigua?
My thoughts is that I would like to build one. It's long overdue. As I was saying earlier, what we have, the model we have now is an asylum. Asylums have been banned everywhere else on the globe since the late 1800s, early 1900s. We still have a yard with wards where people are just housed and live there. In a psychiatric hospital, anywhere in a developed country, you go in, you get treatment, and you leave. Nobody should be living in a psychiatric hospital in almost 2024. So my thought is to build a private psychiatric hospital to deal with all ages. Currently, Clearview deals with 18 and up. My only concern is, and I'll share this with you, with a private hospital, there would be a cost. And as I mentioned earlier, mental health mostly affects mid to lower financial costs, financial families. So a private hospital is a good idea. It would be something else to offer, but there would be the issue of cost. And I'm honestly trying to figure out how to do a private hospital, but also keep the cost down.
Okay.
So it
I
is
really
in my
want to, guys, I really want us to have this conversation, but I still have a 2-year-old that is still, so I need to check and see if he's up. If he's up, we're gonna have to wrap up. I'm sorry. If he's not, we can continue. So you get to refresh your tea. Let everyone know that Dr. Joseph is here. I'm gonna play a little video for you, and hopefully give me enough time.
No apology. Oh, we shout from the mountains, tell everybody that Secret Boys we straight to quarantine. We not surrendering, we town, village, country, tell everybody that Secret Boys we straight to quarantine. We not surrendering, we town, village, country, tell everybody that Secret Boys we straight to quarantine. We not surrendering, we town, village, country, tell everybody that Secret Boys we straight to quarantine.
All right, guys. It's a good, it's good, it's good, it's good. He's still sleeping. It's good, it's good. We're good. I have to let you guys know I was talking to Dr. Joseph while I was trying to get my son his nap time. And he's like, hi, wait, what he said to you, Dr. Joseph? I'm 2.
Yeah, I'm not 1, I'm 2.
Yes, I'm 2, not 1, 2. Since he is turned 2, okay? That's the thing. When he tells people I'm 2, he says to them, I'm not 1, I'm 2. So just know, okay? It's not 1, it's 2. But Dr. Joseph, the healthcare system in Antigua and Barbuda, we need an overhaul, like a full overhaul. Let's talk about Sir Lester Bird Medical Center. You worked there for a year. What did you see?
It was different in terms of I started working there coming from the United States. In the United States, I worked in the clinic and in the hospital. And I did the same thing at Sir Lester Bird Medical Center. So from the hospital setting, I did internal medicine because, again, I wasn't really permitted to do the mental health piece the way I wanted to. From the internal medicine standpoint, we were sort of limited in terms of what we could do, what you could test for, medication options. Sometimes there were no beds available, so people were sort of piled up in the emergency room waiting to go upstairs.
This is at the hospital, our hospital in Antigua in 2022 when you worked there?
Correct.
Okay, go ahead.
Sometimes the lab machines would break down, so you would have to draw the blood, give it to the family member with the tube. They would take it to a private lab, bring back the result, and then you make a decision based on that result. So sometimes we were operating on test results 24 hours behind. It was also the same thing with medication. So if you wanted a specific medication, again, especially if it was mental health related, I would have to write a prescription, give it to the family. They would have to fill it and bring it to the hospital. And depending on their financial strengths, it would be the same day we got it, if we're lucky, but oftentimes it was a day or two. And so here's someone who's suicidal that you have to watch, or somebody who's aggressive, wandering around, disorganized, disoriented, that you're having to essentially just wait for somebody to bring you a medication.
Mm-hmm.
And so I found it very difficult in terms of the other specialties, because sometimes they would consult. Everybody at the hospital is doing their best, but across the specialties, they need more resources. There's a shortage of nursing. There's a shortage of staff on a whole. And so you're having to wait, stuff is not getting done, or it's not getting done in time. And so a lot of the doctors, staff, nursing are frustrated. But just like at Clearview, they're showing up to do the best they can with the limited resources they have. So I always applaud my colleagues at both facilities. It's not that they have the resources, they're just doing whatever. They actually don't have it, and they're trying to do their best.
You know, some who might be listening to us might say it's common. It's common all over the region to have, or all over the world to have such issues where something might break down, or it might be common in the Caribbean where you have to take your own blood to get the results and bring it back. But is it really?
I've heard of it in the Caribbean. So stuff that I see here, I tell my colleagues in the United States, and they cannot believe it. They almost want to come and watch, because I'm used to, if I see someone, I order a test, the test gets drawn, I will have the result in an hour, and it's through the computer. It's not on paper, it's very efficient. So to have to draw blood to give it to the family members, to go to the lab and bring it back, is just unheard of. But I've heard this argument. I've heard people say, well, Antigua has myself and Dr. King. There are some islands that have no psychiatrists, as if we should be grateful, which I believe people are grateful, but at the same token, you can't look at somebody else's misfortune and say, well, we're sitting pretty. Yes, you have 2 psychiatrists. That doesn't mean that it's okay.
Wait, let's back up a little bit. We only have 2 in Antigua, yourself and Dr. James King?
Yes.
But then when you spoke earlier, you said that you were told that you couldn't forward any of the patients to Clearview.
Only if they're suicidal or homicidal.
So what happens if they're suicidal or homicidal? What happened? What were you instructed to do?
So I was told that the minor offenses department at the police station know the procedure. So I am to instruct the family and or the patients to them, and they will get them to Clearview.
Only 2 psychiatrists in Antigua, yourself and Dr. James King, that wrote that report for Clearview.
Yes.
And we have a mental health crisis in Antigua and Barbuda.
Yes. So there's a shortage of psychiatrists across the globe. Even in the United States, they keep calling me to come back because there's a shortage all around. However, and I'm going to use the US statistics, 1 in 5 people have some form of mental illness. So if we have 100,000 people, that's 20,000 people in Antigua struggling with some sort of mental illness. It is unrealistic to think that 2 people can manage 20,000 people.
Yeah.
How many of those people are having a crisis like today? How many of those crises could I see alone in just today. It's physically impossible.
Mm-hmm.
And so there needs to be more. Yes, we're grateful to have more than one, whereas some islands have none. That doesn't mean we sit back and think, okay, we've checked the box, we've fixed mental health. There's more that needs to be done. Just because we have something, that doesn't mean you can't strive for more, strive to do better.
Yes. There's a question here. What about psychologists? How many do we have in Antigua?
I don't know the exact number off the top of my head. I have a psychologist that works in my office. He sees depression, anxiety. I refer a lot of my couples, whether dating, married, to him. He also does family counseling. Because since there are only 2 psychiatrists, I don't have the time to do as much counseling as I would like. For counseling to be effective, it's once a week or every other week consistently. Right now, I'm booked until the end of January, so I would not be able to see people. And so I often refer not just to the psychologists in my office, but other psychologists across the island. There are also therapists, clinical therapists that do counseling. There were, I think, 2 psychologists that migrated to the US. They still do counseling, but through the computer, through telehealth.
Yes.
But the exact number, I don't know off the top of my head.
What's the difference between the 2, a psychiatrist and a psychologist?
So there's a lot of overlap, and it's very easy to confuse the 2. But I try to break it down like this. A psychologist will do counseling. So you identify there's a problem you're struggling with. I hate my job, or financial stress. They will work with you on that issue. A psychiatrist like myself assess, we do diagnosis. So assess, do you have major depression? Is it panic attacks? Is it post-traumatic stress disorder? Are you schizophrenic? The psychiatrist also prescribes medication. A psychologist cannot.
Okay.
The psychologist can do other things. Some psychologists can do testing, for example, in dementia patients, to figure out their functionality. Can they still drive? Should this person still work? Should they not operate the stove? That sort of thing. With children, if they're struggling in school, you can figure out, do they have a problem reading, math, that sort of thing. So there's a lot of overlap, but those are just some of the differences.
Nice. Guys, I want to let you guys know, it's the first time I'm actually streaming to 2 of my platforms at the same time. I just want to stick that in there, because every time I look up at it and I see that to check, I was like, funny, learn what to do. You know, I'm learning this platform thing. So I was able to, I'm live on the Free Press 268 Facebook page. So if you guys are sending comments there and I don't see it, I do apologize. I'm going to check my other phone. But I'm seeing some of the comments coming in here. This one would be, okay, I did ask that question. What's the difference between the 2? Oh, this is a lovely one here for you, Dr. Joseph. This one says, Dr. Joseph, thank you. I pray that you're able to keep pushing for better in this field and bringing key issues in mental health care in Antigua and Barbuda to light. This comment is in no shape, way, or form meant to be political. But when we have such struggles, yet find to put our very limited resources towards an annual free concert in a country where we have a fete every weekend, it's hard for me to not be annoyed. Yes, and you know, politics is not about, it's not personal, it's about policies, you know, and we're talking policies, and we're always going to be talking about the policies. I saw some other comments here I just want to share. One second. All right. This one says organizations such as Lions Club, Rotary, etc., in addition to corporate Antigua, should put together to raise funds for a proper facility. The abandoned cancer center, for example, can be converted into such a facility. These are really good comments, really good participation, guys.
Yeah.
I want to thank you so much. Turks Lee says, wicked set of people, instead of embracing Dr. Joseph, they have worked against her, knowing there is a mental health crisis in Antigua. And I say, a wicked set of people. I want to know if I can say, move Malwin, but not, you don't say anything, Dr. Joseph, you're not in this, just, even if you want to go freshen up your tea or something, you ain't saying anything, okay? You don't say nothing. Move Malwin and move Dr. James King. Because if Dr. James King, if you're the head of Clearview, sir, you're the head of Clearview, and you sent in a report, I didn't even know that you had such power, like such weight of the pen. And you used that pen to complain like if you had no influence at all. We can talk about you in a bit. Not in the presence of Dr. Joseph, but we can talk about you in a bit. In a bit. All right now. In a bit. All right. This one says, all right. Asha, you're on the ball tonight, man, with her comments for sure. Asha says mental health care in Antigua is cost prohibitive for many, so it makes it difficult to do the necessary work to get better. As
Yep.
mentioned, a lot of low-income household members struggle with different forms of mental illness, and apparently, if they're not certified lunatics or have harmed themselves or anyone else, they have to suffer in silence with no healthy way out. This is really serious. You know, we've been through so much with COVID, going through, people still not understanding what's happening now with themselves, with their, family members. Individuals are just dying, Dr. Joseph. Like, I can't even explain to you like what's happening. Like, one of my best friends, I'm still, I brought my rum to give a toast to her, you know, but everybody just, we're just losing our lives, and it's just, I don't know how to explain it. It's like it's not important anymore. Like, we are not as important, you know, like, we're not important as these hotel deals, and we're not important with the, well, it's a lot of hotel deals, eh? It's a lot of ground breaking and ground shaking that nothing really happens. But these are serious issues here. These are serious issues you're talking about here. And for
Well,
you to receive this kind of treatment, I mean, why would anybody treat you that way? Why would they? Even Dr. King, is he jealous of you? You know, is he intimidated?
I wouldn't go that far.
Does he think that you'll take some of his patients or something? You know, is it a money thing? Is it not even him, but is it a money thing? Why we can't get real proper care, and we can't get clear view fixes? Is because it's not going to have a profit, bring a profit to the government?
I believe it's because it won't make a profit because, as I've mentioned before, it's mid to lower financial class that you're treating. They are not going to, you can't charge a higher amount to make a profit, let's say in a hospital. They can't afford it. And so I think part of it is the returns aren't going to be what they need to be to justify that move. So we're not going to bother. But I am disturbed every time I hear about a suicide. I'm disturbed every time I hear of somebody being permanently disabled. So look at this year, or even I'll go as far back as since I've returned to Antigua. There is the issue with Miss Finch and the young lady who's now being charged. There's multiple individuals. One
As
gentleman
in
was hanging.
Jane Finch. You're making reference to the Jane Finch case.
Yeah,
That was so heartbreaking. If we can just remind people about that, because I was here in the UK, I saw the post on Facebook.
yeah.
That was so heartbreaking that she actually put a post on Facebook saying that there's somebody trying to get into her house.
Mhm. There have been people who have hung themselves. There are individuals found in their vehicles. That foul play has been ruled out. That only leaves the one option. There's the young man who now only has one kidney after being shot. Um, I mean, permanent disability and death are the final outcomes in healthcare, whether it's physical health or mental health. We have been seeing that. I'm sure it was going on before I got here, but there's been quite a bit of it just in the 2 years I've been here. And I do not see
permanent
that.
disability and death.
Yeah. And death. That's all there is. It doesn't get worse than that. There's no other outcome left to happen. It's been happening. It's happening in increasing frequency, but nothing is being done. Nothing is being said.
What kind of
It's
facts?
just,
What kind of facts or what trend or what can you give us to validate that to some extent from your own observations?
so from my observation in 2021, September of 2021, there were at least two, possibly three suicides just in that month. In October of 2021 would have been the loss of Miss Finch. This year there was a gentleman, I believe it was All Saints, I don't hold me to that, a young guy in his 30s that they found hanging from the rafters. There's been several individuals found in their cars, possibly suicide. Some of them foul play has already been ruled out. Outside of individuals who have completed suicide, the number of people that come to my office with a plan, who is going to overdose, who's going to shoot themselves, who's going to cut themselves, who's going to hang themselves. Some of these people I've seen, they've attempted and survived. They're now coming to be evaluated. So I'm basing this just on the increasing number I've seen 2021 compared to 2022 compared to 2023. And so outside of what may be in the newspaper, there's a lot that I see in my office, but nothing has changed. We have no new laws in place, no new facilities in place. There's been no response to the increasing crisis, at least that I'm aware of.
What kind of a response should there be?
Well, I believe there needs to be more resources. So one of the things I've been told is that Clearview is a 24-hour facility. You can call at any time. I get calls at least once a week from somebody saying, I've called Clearview and they told me to go to Sir Lester Bird Medical Center, which has no mental health resources. Or they will tell me, I was told that you should go to the clinic, that there are mental health clinics across the district clinics. They never get seen. They don't know if there's a schedule, when exactly they're going to be there. And so they call me saying, I just need an appointment.
Yeah.
So we need resources that are readily available. People need to be aware of them. If the clinics is going to be in Clear Hall Mondays only, put something out there. Everybody's on Facebook. Put it on ABS for those who are on ABS, but put something in place where people know where they can get help. Most civilized countries have a dedicated suicide hotline, toll free, meaning even if you have no money to your name and you're suicidal, you can call and get help. We do not have a suicide hotline. At one point, my work cell number was being given out as a suicide hotline. So I was being woken up at all hours until I realized that that was what was happening. I don't know where that started, but several people called me thinking my cell number was the suicide hotline. And I help where I can, but there needs to be something in place. So there's a lot that needs to be done. And it needs to be done in such a way where John public can afford it.
Yeah.
regardless of
I'm,
the
I'm,
situation.
I'm really appreciative of this. I can't explain to you how independent and free I feel to be able to have this discussion with you, Doctor. I'm so serious. On such a matter as this. You know, it's not a laughing matter, but
Mhm.
it's a very serious matter, you
Yes, it
know.
is.
and I'm very grateful for us to be able to have this discussion. Now, I want to say that I have a nonprofit organization, Women of Esteem, and I do a camp with girls ages 7 to 17. I'm very interested in us doing something. I'm very interested in us creating some kind of virtual source or a virtual space. We can talk about it off air, and but a virtual space where the same low income families that you're talking about, whether we can find some form of sponsorship or something where we can offset the cost for them, but they need to be able to see somebody. They need to be able to see somebody. And we can't just come on our platform and talk about it. We have to be about it, and I get great reviews regarding you. One person said, "Oh, she's really great. She's really good doctor. I'll be tuning in." And that's a very good response, I have to say. You don't have to know who it came from, doctor. Don't you want to know? No, I can't tell you. Don't try to. Don't ask. But I'm very, very happy to have you here on the platform tonight. I would love for us to do a part two also in this discussion, because I want to see, now that we've had this discussion, it's out there. People are seeing that, hey, that there's an issue. Listen to this. And you hear giving us the facts on it. I'm curious to see what's going to happen next. I'm curious to see in the next week or the next 2 weeks, in the next month, in the next year, what's going to happen next. But I'm eager to bring you back for us to have a part two of our discussion, and where I'm definitely going to do cuts of this too and rebroadcast on the platform and try to, go through it. My time is I'm very strapped for time, but this is really important, and I'll try to cut it, the key parts, and we can play them again, and I'll even try to send them to your email, and we really do the work together, because we can identify that it's not being done, and we can't just sit and say it's not being done. We say it's not being done, but then we show them how to do it. That's how we do. Show them how it's done. That's what
Yeah.
they need. So I want to offer you an opportunity for your closing comments. And I have to say, I just want to do a little toast to my friend. Would you stay here and do a toast with me after you've given your closing comments?
Sure.
Oh, thank you.
Well, I just want to thank you for allowing me to be on this platform to share this information. My purpose for sharing the information is not to cause strife. Mental health is not a political issue. This is not to be used as a pissing contest between parties. We're dealing with people's health care. And so I did this so that people can be aware of the efforts that myself and others are doing. There's more to be done. So I hope those who are listening, if your political affiliates are looking for something to do, bring up this issue, see if they can cause something to happen before somebody else is disabled or there's another unnecessary loss of life. I will continue to do the best that I can with the resources that I have, but I'm just one woman, one voice yelling in the background. So anyone who is interested, willing to assist me in doing better for mental health in this country, I'll share my number. It's 464-9095. Again, that's 464-9095. If you're struggling with a mental health issue, or you know someone who is, you have a question, you're wanting advice, you can call, you can send a WhatsApp. I have WhatsApp on that number as well.
What about email? You have an email address?
Yes, but I'll give the office number as well. That is 562-9581. And my email is cjoseph, JOSEPH underscore med, MED underscore psych, PSYCH at outlook.com.
Okay. I hope Denise and Tika and everyone. Okay, I see Tika. Tika's on the ball. Already reposted the number. She's on it. So the numbers are 464-9095. That's the cell with WhatsApp. And it's 562-9581. That's the office. And the email address is CJOSEPH underscore med, MED underscore psych, PHYCH at outlook.com. So
PSY.
yes, PHY. PHY.
PSYCH.
Oh, PSY.
CH.
PSYCH. Oh,
Yes.
Nikki.
At Outlook.
Silly Nikki. All right, guys, please repost in the comments so that everyone can get it. And feel free to message me too if you need it. But Dr. Joseph,
Yes, ma'am.
you're a Joseph.
Yes, ma'am.
And they say all Josephs are related.
That's what I've heard.
And that's all we'll say.